Hello, I'm Jeff,
And I'm Mike.
And I'm Margie.
and we are registered nurses who work with Dr. Fritz to provide a unique sedation experience for our clients. Today we are going to be going through the patient's path from arrival to the office, relaxation room, to surgery, to recovery. And we are going to be outlining the roles and responsibilities that we have as registered nurses working in this capacity. Patients that are coming to us for sedation often have a high level of dental anxiety. Once in the relaxation room, have the patient sit in the comfortable lounge chair. Further introduce yourself. Hi, I'm Jeff, and I'm a registered nurse that works here with Dr. Peter Fritz. I'm going to be helping with the sedation portion of the procedure, and I'm going to help to ensure that your experience is as pleasant as possible. First thing I like to discuss is the medical history and have a discussion regarding their medications. It's important to find out what medications they're on and especially what medications they've taken prior to the procedure. The patient must sign a surgical consent form as well as an IV sedation consent form. Perform a full set of vitals, including temperature, blood pressure, heart rate, respiratory rate, and oxygen saturations. If the patient is diabetic, ask if they've checked their sugar, and if they have not, it is a good time to take one. Give the pre-op medications. For most procedures, we will have them do a rinse with Paradex, followed by amoxicillin 2 grams, ibuprofen 600 milligrams, and then triazolam, which is the benzodiazepine that's going to help our patients relax. At this point, I recline the chair, cover the patient with a warm blanket, if they wish, dim the lights, and turn the music up to an acceptable level. Encourage them to relax and get as comfortable as possible. That we check in on them every 15 minutes post-oral sedation.
Once the patient is completed in the relaxation room, I would be bringing that patient into the procedure room and apply a nice warm blanket. I would apply the blood pressure cuff, the cardiac monitor leads, as well as the O2 sat monitor. Once that's completed, I would start the IV. Again, once I have all the patients settled in, I would lay her down. And I like to do this about 5 to 10 minutes prior to Dr. Fritz coming in, because I like to give the patient a chance to settle in. Once Dr. Fritz comes in and starts the procedure, I just give the medication as per his orders. I continually monitor the vitals of the patient throughout the whole procedure and record the vitals every 5 minutes. Once the procedure is completed, I just continue the IV and assist the patient into the recovery room.
The last stage, recovery. So you're going to take your patient from the OR and very carefully walk them to the recovery bay. When you get to the recovery bay, put the patient in the reclining chair safely. Put a nice warm blanket on them, bring the driver to the patient, have them sit with the patient, and you're going to review all your post-op instructions. Post-sedation instructions for the driver and the patient. Obviously the patient isn't going to quite remember any of this, so it's really important that the driver does understand. The patient is still under the influence of the medication, and it can stay in their system from anywhere between 1 to 6 hours. Everyone is different, and you can let them know that how they know the patient's under the influence is that their memory is affected, their mobility is affected, their comprehension or just perception is off. The best thing for them to do is to go home and go to bed. Put a towel underneath their head, and then in a few hours they should wake up and feel fully refreshed, alert, and oriented and ready to start their day. But another thing that they have to remember is that someone should be in the house with them until they're fully awake and alert, as well as no driving for the next 24 hours, no shopping, no signing any legal documents for the next 24 hours. Other things we'd like to put in here is talking, texting, and being on the internet, is to refrain until they're fully awake and alert and they know what they're doing. Once you've covered those items, then you redo the patient's vitals and then help the patient out to the car. As you're doing this, you can also remind the patient as well as the driver that a phone call will be made the next day to see how they made out post-operatively. But if there are any issues in the next 24 hours, that there are emergency contact numbers on the pamphlets that we have given them. I hope that this information is helpful for you. And if you do have any questions, the nursing team as well as Dr. Fritz are very supportive with anything that you need to know.
On behalf of Dr. Fritz and the whole office, thank you for watching.